You get a driver's license when? 16. Depends on your state. Well, even voting used to depend on your state. Drinking is what? Except President Moat and a few others talk about some changes with that. The whole point of this, even if I'm not fully comfortable with chronological age defining children, because at any given age there's huge variation. The issue of how many went to Healthcare Center last week? What was the point when the president came about healthcare reform? What was his main point?
Healthcare for everybody. Healthcare for everyone.
Healthcare for everybody. But in particular, he came here because he was trying to make the point about your healthcare, your health insurance. Your health insurance, you're in that age group somewhere above 17 and somewhere, typically, at least undergraduate, below 25. And some folks would define that as children and young adults. Some folks would stop at 17. The whole point of all of this is when you look at data and you look at statistics, you're going to see different denominators. You're going to see 0 to 17, you're going to see 0 to 18, you're going to see 0 to 21, you're going to see 0 to 25. Why do you see different denominators? Any clue? Does it make sense? No, it doesn't. The reason we see different denominators is because down the road there's a big agency called the National Center for Health Statistics. And when I first came to town 30 years ago, all they did was collect data and aggregated it into every 5-year units of analysis. So, 0 to 4 became the same. 5 through 9 became the same. 10 through 14 became the same. So the issue was convenience related to data, not related to growth and development. So what do you see on this slide? We're going to go through some of these quickly. Look, this is the trend data, so just get some orientation, right? It's about, in some cases it's 50 years, in other cases it's about 30 years, and then there's some projections. What do you see on here? Anybody?
I mean, it looks like the number of children 0 to 17 is increasing, but the percentage kind of, I mean, it seems to be decreasing for white, non-Hispanics, and staying pretty level for the rest of the groups, black, all other races.
So just, I don't know if all of you can see, some of these slides are percents, and some of these slides are absolute numbers. In this case, it turns out to be less than 18, and it turns out that it's about what? You project it back over. About 75 million, in rough numbers. And there's, how many millions of Americans are there? People, at least not including the undocumented and all that other stuff we can talk about. So it's 75 out of about 300 million, right? So who said about a third? You were close. But is that number meaningful? The short answer is yes, but mostly no, because the range from 0 to 17 encompasses multiple developmental ages. So if you really want to look at these issues, you have to look at them at the age units. Down here, the predominant racial distribution over time is white, but what do you see on this curve? You don't need a PhD in epidemiology to see it. It's going down. And the projections, things are changing. Hispanic population, black population, about stable, Asian population. These are projections based upon births, deaths, and some level of immigration. Oh, now I can turn it around. I don't want to look at it. So what's on this slide? What's a typical household? Here's a test question. Who knows who Ozzie and Harry were? Any clue? Ozzie and Harry? Huh? Well, they were an archetypal family. Talk about family centered. 2 sons. I should have shown you some slides. There's some families that in the 50s, clearly white, clearly middle class, but they represent a traditional family at the time. What's a traditional family at the time? Husband and wife, 2 parents. Tragically today we have 2-parent families. We have many 1-parent families. And unfortunately with AIDS in children, we have no parent families. We have kids who are really wards of the state. They're not in the same sense they're unadoptable by certain circumstances, by certain standards. So the state becomes their parent. But you see all of this, and the issue, who saw, well, was it Today's Show or Metro? I get confused what's on in the morning and what's on at night anymore. Bill Cosby. Anybody know what Bill Cosby's campaign is, what his program is? His program is really to strengthen families. His program is that we need a mother and we need a father. Do all children have a mother and a father? Yeah. Absolutely. Obviously, at one time, they all had mothers and fathers. The question becomes, what happens afterwards? The vulnerability is there. Here's another interesting issue. When you start to see some of the data that characterizes the vulnerability for children, births to unmarried mothers. When I was a house officer, a pediatric resident in Boston, a birth to an unmarried mother was called what? Any clue? I tell you these things because there's some social. You're close, but we didn't use that. Does everybody hear that?
Yeah.
Bastard, which translates into more formal language as illegitimate. Just think about this. There's typically no father recorded on the birth certificate, so the birth certificates are stamped illegitimate. What happened in Boston? What happened in Massachusetts, the most liberal state in the United States? Well, maybe not, but pretty close. What happened when it was stamped illegitimate? Number one, no birth certificate was issued automatically with a celebratory note from the governor and the congressman. No celebration. Number two, mom had to go down and file a request for a birth certificate. Traditionally in Massachusetts, every newborn got a home visit. Somebody came home and said, how are things going? Can I help? I mean, in those days, the nurses, in fact, used to carry around a scale. And if you were, quote, illegitimate, what didn't you get? Didn't get a home visit. Who would you think would be more likely to benefit from a home visit? The mom who doesn't have a father recorded on the birth certificate. So how absurd are some of these issues? I'm sharing this with you because you don't see this on the birth certificates. You don't hear about some of these kinds of things. But all of these issues have consequence